Office General UTV and I'm seeing what we maintain back wono ena edinkre ba nti owura ata yebo adoda fro Yesu ana woko abetifie na wa happy birthday na adwo ebo aje se na atade na ohye no eye sewa closet sewa closet ewo odoko traffic light techno abro san no so aha techno abro san no so ho ena saa boutique ye friend sewa closet no ewo nti adwo ebo atade ohye na meka ho asem no ho na okoji no se menka me ye na o se ma bon na me be ma dada se wa closet mi hu bebi o na me atade se ye bo mi hye bi nti me de no metumi hu bebi e wo ye bedi komo ade afa COVID-19 adwunu mu ha obetumi de aba ho esanse yare bia ne se di sitie na I say obi nya bia wa hu nipa bia nya bia o ti bia ni mu ayedin a state a mu no ana otumu se desperation mi hu dia menka mi hu dia menye mi bewu ana menya nkwa na nti emma nipa no twentwe ni bebre nti ese ahwe ni di sasam nkomo se ne be ko ba se bi obi nya bi mpo a bia ne yem nko hyehyɛ ni bebre na enkofa ha fufuru bia nso emma na ene yene Dr. Isaac Newman Arthur or a medical doctor and a clinical psychologist wono ne yene bi di nkomo afasa asemi ho na ye de aseda ebema Amy Scientific Herbal and Alternative Medical Hospital ase se womo na eboama ye de apomudi nsami abremo ye ka Amy na ye Allahu Shafi ye nyankopon ono yaresafo de enti a Amy Scientific Herbal Hospital edan so kra wo hospital wo do nyina ho ne se odi nubrane habamba na ayi nuru na odi bama na odi abefo kwan ye fa so de hwe bibia yare ne dum pempenso wo yare kwan ha wo no nti o tesi hwe bibia wie no ohunu bibia yare no wo ene bibia yare na du a no wagina so edi nubrane habama no asaw yare nti be wie no e complete wona wo sen no wo mo so wo manum bo nya den se wo bi se woni bi emi ne nko na akwa a ye be hwe o se de hye preko pe omo nkorabata bibre o mamu ni nyina mu abasobon de wo gye sanse di nwuma pa edi na chi obabi okobia enkra ha omo ewo Snake Flatter ewo dome udru tantra runabout ho a go filling station no opposite no ekwane da wo ne ho a na wo mo Ashaman eye Klagon Ashaman under bridge wo obi hu wo mo kuma se kajetia atwuma tachiman tamale borgatanga hu na fi hohoi takora de sunyan doma wa atebu anemi ahodo nyina kwa Amy Scientific Herbal and Alternative Medical Hospital ewo ho ambehwe amana abroso kra betuma from so 020 722 9505 and afi 0244 227 192. Dr. Isaac Newman Arthur, good morning.
Yeah, good morning.
Na pomu ti say.
Nyamiado moko.
The radias bibi ofi ba ho ye de.
Oh, nyamiado.
The radias. It's a doctor for na ba ne ya nko a. So munim de so kosoro pa. Ya da mo asese mo hwe yen. COVID so far bibi edro rate a ekosoro na sefo no. Being a medical doctor and a clinical psychologist no. Holistically kan nyina bomu a amanfa adwene mu ye omo sen e wo se da yare ekoye hu.
Inti ye ka mental health ye gina enyoma miensa so to say obi wo mental health issue and as a illness. Three things. Usually ye ka mental health people are thinking about obi wabodam. Inti three things: how you think, feel and behave. Senya wodwene fa, wo feel fa, ena suban a woda na die senya eti. So any thinking or feelings or behavior are affected or no. Ebia ekose ya obi anase untumi en kwa ho ewo adwumadie ni day to day activities enyoma ese wo ye. Ena ebia ese nyoma ewo around you, maybe your relationships, your work, your environment, and even deviation from social norms. Say ekwan dey atoso say society say e faso no. Obi a on faso no. It means that the person is not mentally healthy. Okay. Until obia or struggle to cope and adjust. Say ebia BBAC we all go through stuff and then you may see obia mentally healthy no should be able to cope and adjust to situation and I say form and maintain meaningful relationships. And I say ebia obetumi on one kasa to live independently and as on one bet na say abobo abrabo no mu oye ne ese oye nyina no You know, and also ono GDA what ono ankasa potential or obe to me adia nyoma so ye nyina no. It's all part of mental health. A person's thinking, feelings and behavior and sending affecting of fun is under mental health. Into this season,
okay.
This season, COVID-19, you know, send you start to be do something new. I ain't shed in new man. Send you tifano. Impact, you know, it's not just physical. Say be a virus in an area in your lungs and other parts of your body, you know, but how you think, feel, and behave, which is under mental health, you know, is huge, and the impact, you know, it will go even beyond the pandemic. After the pandemic is over, which personally I doubt because of the way the virus is behaving, the impact of mental health issues, you know, outlive, you know, the impact of the pandemic itself. Into which all the mental health, you know, complications near there. There are about probably, you know, 3 major ones and kind of account consequence of these 3 major: stress, anxiety, and depression. Stress, anxiety, depression. You know, any frustration, any guilt, any boredom, even abuse has gone up because those days, you know, say, you know, because of all the limited social activities and limited movement, you know, ama abuse so akosoro. Because those days, when people use social activities, any moving away from the home near the end, to deal with an abusive relationship or environment. But you see, they are more with the abuser than, and the stress and anxiety near the end, also in this season, so no, is influencing, you know, and you know, increasing abusive behaviors here and there. So anybody who is not able to deal with their stress will be on to me and delay when the stress and anxiety near the end. The person may go into depression, and depression has its own influence on suicide and suicide-related issues and stuff like that. And now we also know, say, virus, you know, attacks the brain. COVID-19 virus, you know, also into be maybe severe to moderate form of, you know, COVID-19, you know, will come up with some, you know, mental problems, you know, residual cognitive functions near there, you know, send your adrenal functioning day-to-day decision making, cognitive function, and also
it's a more one can watch no. Na adwendwene so asa adwendwene so asa abaka. Nti say e ma pressure ba adwene so pa.
Nti say yahwa most of the interventions, you know, by various governments, you know, focuses more on the physical aspect of everything. If you look at mental health issues all over the world, you realize that the impact of mental health issues, you know, on health, you know, is underestimated. And I say because on TV today you are doing mental health. How many TV stations even talk about mental health? We don't. But the impact, look at the Obia single mother or two kids. Because of this season, business is gone. Say even the anxiety about when is it even going to end. In addition to that, we lose a juma. On to me, because everything I come from Kra. And also on one Gitamudia and Koning Kofu, and also at social distancing and all that. Now students are in school, but they were at home. And Kolani taking care of the kids and all the issues around kids and all that. Now parents, you know, kids are at school. Parents are thinking, what happened to my child? You know, and it's huge. And because of that, some people come to the hospital with, you know, some maybe a headache, BP, kosoro, any non-specific body aches here and there, will be paused. I have a patient who always calls me, Doctor, Makuma Bubobo, Adam Bewuana, because of the fear, you know, and anxiety around this. Maybe our relative being a COVID-19, only came into contact. And stuff like that.
And no one test so nyabi.
Oh, and your is a crowd. Now, Jaka said, what started Kofu Kakre, we must show overcall, yes, COVID-19 test. Also, a chance about maybe a week be, and say 3 days you can get it, depending on where you go. Now, we'll try results. You know, it's a whole lot. And I say, even those who have been diagnosed with COVID-19, to be able to go through that phase now, you are thinking, would I die or I won't die? Because you are hearing people who are dying. Then in addition to that, you are hospital, no? And here is a cry. Me, I go to hospital all the time. From here, I'm going to work. You know, you are thinking every patient who comes is a candidate. And sometimes you attend to be who names say COVID-19. Later results come say COVID-19. Now while you're doctor, you have to go on self-isolation. Me my course I met 4 times. And the last one was about 2 weeks ago. And here is the cry. If you are a health professional, that's all why. And here is it. And I've been to super hospital. They are afraid to disclose say they have cough and stuff. Because on him so
test no.
In Tiabanisana, those who are in the hospital are exposed all the time. If you are a nurse or a doctor or a radiotherapist or lab technologist or nutrition, anybody who works at the hospital, you know, is under a certain kind of, any doctor who says they are not really scared or what, because you are at the forefront. Every doctor is at the forefront now. Because anybody you meet in a hospital, it's a potential, you know, COVID-19 patient. You know, all the stresses in reorganization, while organizing your life around this time. Even those who have money are struggling. Businesses are struggling. You know, you have to lay off people near there, and are trying to look for money here and there to be able to maintain a certain system. And here is the cry. It's very difficult. Working even from home, it's not easy. Now students are in school, online sessions. I know a student every day they have to buy credits, about 30 Ghana cedis.
So data,
online data has become a major problem even for students. In this onisika, that's one to go online for Zoom meetings near there. SL lectures or qua. Now say they submit assignments online, and here is the cry for students because they need to really maintain that kind of system in order for everything to go on the way it has to go. But now, thankfully, the government of Ghana has done so well with mental health issues. You know, when it comes to this season, Ghana Psychological Association, Ghana Psychological Council, Mental Health Authority, all over the place trying to provide, you know, even Ghana Psychological Association had to put out some numbers. As OB or some psychological issue, they can call for some services here and there.
And the psychological issues, you'll be
also.
Who can you cry no? And yes, be a COVID-19 kwahumpo.
Yes.
Na juma enko yi se de awokan yi. Okoto ne ma ne ba so kodidwa, yenuanom me kodidwa yi. Ne ma hye da enko yi papa. Obi ono a ne business o ye. Mo hye de obi a bi emphasize obi sport bi na ja. Aya na otonton ne ma yakra say sport yi atum. Obi a enti no are you so complicated? I'm ohu ebia ne time aso esi yitu ne rent. Say onye scan konkutua ensem bebre. It's happening here,
yeah.
But can you say so? Ghana phone him mo sa mo clinical psychologist. Ghana phone him pa.
Yeah, you know, in the past, no, now a dean because now you endorse. You still as you endorse mental health professionals who have been accredited. You know, again, will be accredited.
Sure.
You know, there are a lot of people. So we have the psychiatrists, we have the psychologists, we have the counselors, we have the psychiatric nurses, we have, you know, all kinds of mental health professionals. I don't think we're even up to 1,000. You know, to take care of about 33 million people and 30 million, you know, Ghanaians. And here is the cry. But now, you know, thankfully, a lot of people are getting to understand, say, mental health issues no ho. Inti omono, they go to the hospital to request for it. Now, thankfully, no, now almost every hospital there is someone there or you know in charge of mental health issues. Now, so hospital they can refer you to see someone who obey to me on that level. Inti is there. People now come to request. You know, I have all kinds of calls coming in all the time about some of these issues. And yes, be a help in you, help. You can walk into any hospital. Oh yeah. Wait me, walk into any hospital and ask, say, oh, I need obia, in terms of mental health issues now. If they don't even have, they will refer. And that is how the government has made it now.
Yeah, sure. Enkwada ewo suku yi awofo yam hwehwe wo mo.
Yeah.
Enkwada na kura nkasa wo suku mo ankra mo yam hwehwe wo mo. Sa yam hwehwe enkwada ne awofo nyina wo mu yi no. Ewo ho.
Yeah.
Ebi no susu se school so no kan ke yentum bio back. Ne sign tum. Eho ade akwada ewo ho yi me yam hwehwe me. Yesi yesantum. Ma adwenu sanko ye bebre dodo.
You know, at this point, you know, some of these questions, didn't say, because now we are thinking, say, if they come home what is the implications? If they are in school, implications need to say. What is the research saying? A lot of research has shown, say, the spread of COVID-19 among students is lower than in the community. In this kolano or fear, nasa osumanoa, also on kofkrom, enkoye bibia. The risk say ubenye bino is higher than senko school. Some research has shown that way. If you look at case by case country, how many COVID-19 patients are coming from the schools? Now, people are saying that, and from all kinds of things, say students are coming in with COVID-19. Into what is the best way? Into best way, no. And I think Ghana Medical Association, I think so. I think I heard a news say they've come up said they should close. I'm not sure
how. That's the regional president.
Yes, Senka. If they close down, what are the implications? Say in Kolani be fear, the spread any idea? What is it? If Senkolani was school CCR, Nase Abia Omo there are about 1,000 students, 5 will be. Almost spread it to 100 people right now or 200 people right now. These 200 people are coming home. Fear. Their students may not die, but they are coming home
to infect their parents.
To infect their parents or infect the people around. So the risk of trying to close down and keeping them there, no, you have to look at all that and make a decision. At some point, you should not say, oh, the spread in school is going up. Closing down the school may be justifiable, it may be understandable, say, this is what is happening. But at this stage, is that the best decision to take here and there? And that one, I won't take that decision. The policymakers would have to take that decision. But considering that is also not wrong, depending on the figures Ayenya was school. If we think that is the most helpful way, that is fine.
Yeah, sure. Yeah, can say obi wa when you be owufie. And na yehwe no. Obi so at the hospital say can say UTV. Sandy panel what goes through then a fan then now na dwunim. Oda ho nyina no e de na ekoso na adwene mu se ye ni de ekoso na adwene na se ye ni mu a mu na moma ben wo sa ye ni mu se mu ni mu a e de na odipa ne se oye de wo fie a wanya bi wo fie de oda hospital no so wanya bi no e de na se oye se de be ya adwendwe no kura isa adwendwe nkum
yeah
adwendwe no kura nkoma no enko tibia mu edin
yeah anti me I've gone into self isolation 4 times into minimum seniority. I remember the first one was at the beginning. I didn't need NTS crown. You know, it's very traumatic. Say, oh, kono like a shurankasa. You have no idea. People who are going to a shro any attitini or how a baum. You have no idea because we know say sometimes they look normal, fine, then sudden change and they die. Enti sa esuro no eya ade a ewo ho a nipa kro no day by day and na esuro so say was spread already to a loved one because e be on any area na nimba ho a e be spread, so that is there. And also fear that they will lose their jobs, because they will not be there. And the stigma is say when you be an obi atise obi work COVID-19 and also into obi otisa no. There are about 4 things I would suggest. First one, and say, anytime we are going through some problem, I say, yeah, we have to be positive about everything. Positive mindset. Say, what you are doing in a way, emfa or how embre also, any whom bre also. It's important to be positive. I don't even know how to say it.
Say,
GDA be in a positive way about whatever is going on. Because, say, if you are negative, you won't solve it. If you are positive, you won't solve it. But negativity, no, Emma going through the situation more unbearable. Say Emma ukwa more, yet you will not solve it. Into anxiety has no benefit. If in Kawusuru, na say ebe buawa, in no, it has a benefit.
And I say mo kura na mo say doctor fu kura na mo ka say adwendwen kura na my immune system no kura ye mre.
But down stress is one of the major depressors of the immune system. When people are positive, they go through that experience well. They go through, okay, maybe it's a baby.
And do's and don'ts, you should TV so. Never been a war, so you can't do so, and it don't.
Yes, it's your positive thinking. Very, very important. For example, you've lost way failure exams. okay, me fail, I'll write again, I'll pass. Instead of saying, so me fail exams, hey, abrabo ye do, me nkwa ma abrabo then na nyame aye mini, me da chikra asay. No, and say, people fail exams, they move on. So positive thinking helps. Okay. Then things that influence positive thinking to us with the fact that people should surround themselves with positive people. Obi a obesha unkre, and you obi obe negative all the time. Obebu abem, and it doesn't help. Then also feed on positive information. There is all kinds of information going on around this time. If you look at the figures, you realize that COVID-19 is difficult, all right, but yenshede and wusa. And to say, what is your dream? Say, oh, menyebi but ebe. Instead of saying menyebi but mewuno, it doesn't help. So people should be very positive about it. Then around this time, people should focus on activities and positive things that help them feel better about themselves. So whilst you are home self-isolating, engage in things that will make you feel better about yourself. Some games, some hobbies, some, maybe now we have online interaction and all that. You can be in touch with people. And
nobody has access to this internet.
Yeah, it's difficult.
Online interactions.
It's difficult. So whilst you are there, you know the things that you can engage in, as an individual that makes you feel good about yourself and things around. When you engage in things like that, it helps. Personally, when I do a lot of graphics, it makes me very, very happy. So time of my isolation, I was doing a lot of graphic design here and there. So get engaged in hobbies here and there. Then people should be more thankful. Say, when we say thankfulness, instead of say looking at things it doesn't help. It doesn't help. Be more thankful. Instead of say this is half empty, see it as half full. Because if you count your blessings and name them one by one, say no. And said I never bad sir. This time we share all the strategies and discover about their jobs. It's amazing. Until Uber say, though the pandemic has caused a lot of pandemic in Yoma Basa Abano. And no man shedan says, sir, say, company. GD or companies are Oma discover new ways. Oma share Nyoma Afufu to me improve your friends and businesses. No, businesses are expanding at this time because of new strategies. Now there are all kinds of online sales near there. Any discover new ways of doing business near there. It's really helping. So people should discover new ways of doing whatever they are doing and look at the solutions instead of the problems. People should focus on the solutions instead of the problems. And enjoying how I make to instead of say you're doing problem, no, because when you think about problems, it becomes bigger. And when you lump problems together, so the problems be put together, it looks too big. For example, if you have school problems, you have marital problems or relationship problems. So what the two no boom to think about that, Edma Adenia can see too much. But if you pick case by case, oh, me school, me nya day was school, then tina me nya day was school, and how can I be good in school? And no, you can be able to think through well and be able to to me as solve problems. So instead of say would it be me now boom, then people should also limit their expectations. Sometimes but tired this year say too much. It affects the way it impacts our mental health negatively. In Tibia, what started business in this time, and I say you are on isolation or something, and I say this time your mind said I am here. You have to be able to reevaluate one guy's expectations around what you are doing around this time, so that women your mind do be even at this time. So if you have a reasonable expectations based on the current situations now, it helps you relax. Instead of all the time you're always anxious and wondering what will happen. It puts undue stress on you. So people should limit the expectations. Then we talked about exercises improves on mental health. Now people may have time. Maybe you are working from home. In the morning now you can do some exercises. Good nutrition. All fruits and vegetables has all kinds of nutrients. Fruit and vegetables, nutrients, in terms of brain function. People should rest more. Make time to rest. Like in the night, make sure you sleep. Even in the day, if you have some time.
Then uncle di wajuma business in Queen as if we nana krama.
And then you may need help. Is difficult. What it means is that you may need help. You may have to go to the hospital for some kind of help. But generally, when you sleep, when you find time to sleep, it helps, the brain, reset the brain in a way. As a switch off computer, switch on computer, now they need freezy. When you switch it on, off, and we restart, as a new energy we have a computer, it's the same even with the body. When you rest, it's like how they are called servicing. It comes back and it functions better because of that. Rest improves on mental well-being, properly. Then also, we encourage them to have more sex because sex also improves on mental well-being significantly. So because during sex there are 3 chemicals that are released, oxytocin, endorphins, and dopamine. All these chemicals, they help improve on sleep. It helps with wellness and all that. That is why when people have sex, they sleep immediately. Because of all the chemicals that have been released. Sex also improves on mental well-being significantly. And if anybody is what do you call it? No chino. That's on him say. Then why you be still it is affecting him. Just walk into any hospital and seek help because there are mental health professionals who can help you.
Yahwe yare nkantanso a enya ewo awofo ne enkwada so. Yebeye hu biribi, yebeye ne den, se bia awofo ebi ono wanya covid, wanya yare bi na fa ne saa. Ana se bia yehwe saa video yi infoni e wo ho yi. Wo mu nyina wo hwe de wo akiri ho pa no a so ordinary the mama so na de wo anim so kura no phone no miamia so na we so e wa ha adwena e bebre ohun de onye no ho obendey ayading especially with students at this time thinking about even following the protocols. We are always washing your hands. Social distancing near there in school. No. It's very, very difficult. Into most of the things we have suggested, say people should do to reduce the burden of mental, they should just continue to do it. It's difficult. So Biabaka say easier. No, even medical professionals, easy. When you go to the hospitals now, you hear some of the things that medical professionals are going through, and you'll be amazed. So anybody who thinks that will hear any kind of help, then share the sube brain. The same way I'll hospital if they have malaria. The same way they should go to the hospital, and we will look at specific issues. Sometimes you may even have to give them some medications to control, all those symptoms to stabilize their mood a bit, so that they can be able to go about their normal activities. Yeah. You say system. We are part of the world, bibi obi abia na gisu ne pana kasa na hoden ne nimde ani ne sika na eye yen hye ni hye ahodo bi a se de aman a ekọ nanim no aban no woni ama bi ode boabo ankrofo kakra nti bibia ni a oni na yese de mani nyina ebra na covid ma yempo no na niema edu ba bi a emu hye pa ma ebinom pa sisi akwakobasa tibia ye wuram sisi no se wo kan nyina bobu se wo kan de akire Ghana for no matter who you are so wo bi so woni bia e de necessary ye.
There are 2 things I'll suggest. One, the same way you didn't on the national level, all the protocols and any treatment in the in the same way, we have to invest in mental health services. We have to invest. OSHA budgets and stuff are almost allocation are there for mental health. If you compare to other illnesses, it will form. Even this pandemic, you realize that mental health professionals, some of them had to take initiative. So one can start better also to be able to help. That is why a lot of things happen even with mental health. Investment in mental health has to go up. On this level of investment too, private health insurance companies, they have to make sure say they add mental health services to their package, because a lot of mental health health insurance companies do not add mental health services to that. In Tebanisana so be a mental health issue be on one kasa and say odi nisika ana bibi, and sometimes a bono cost do emani pakrono. That is the level of policy. And another level when say laws and access to mental health services I say ekoso any the expansion of mental health facilities near then all over the I think in the country even psychiatric hospitals 5 was private mental health institutions and said that doors
they mind their cramp and said them super
yeah said that super into that kind of investment it really has to go on. Then also families, any individuals, they have to also take responsibility on one kind of mental health responsibility. They have to be responsible themselves for their own mental health services. For example, say obi or malaria, we pay money to get well with malaria. Obi or malaria or hospital and temp on chain do answer our hospital. Onya ya peno our hospital. O nitiya niya kakrepo anoko. In the same way, we should have that attitude.
Okay.
Towards mental health service and also stigmatization of mental illnesses. As a community, we have to frown upon it so that we don't stop people.
We have vaccine say ba adwene be na esi enya fa ho ebi no yom hyehye omo say e fa no cool anameboa.
Oh yeah, I say I find it cool because we have all kinds of vaccines for hepatitis B. Your vaccines. You know, polio near there, no. We take them. Intiweso is one of the vaccines. No, and he say yakume to cry.
Dr. Isaac Numanatha, we a medical doctor and African clinical psychologist. But our CPN on pay. So nya breba. Come na de. Nya yanke be di bia ka na so bre nti. Ye do be se na besa mo ababio. Na ya hwe na komo no ye di ni mo pa no. Ebo mo wo fie ni de mo hwe ye nyina se na be ya obi otibia bi mu a obi twa wo kan kura me kura na ma piki na ma bibre de afiri mu se na be bitumi ginjame na me so metumi aye de ese me bi ente be da wase papa yakopon ka mo so se mo so mo de mo nkwato o de ji yankwa that's papa. Dr. Isaac Numanatha medical doctor science ye clinical psychologist ono ne ye ni di nkomo ene anope e de fa adwene mu hawa COVID-19 bitumi de aba ene de se etumi e de fa ho nti nkakra kra gidi se ebe ye ne abetena nti se ne abetena no wo ye den a ese wo so ntumi dane wo ho na wo ne tibia ne hia se ne be ya tibia ne nkobu nka mo mfa wo so adwendwen ye betoi ye be waja ho na mo mama adwendwen ye mfa ye nkontem ye ntwen ya ye bre so a ye beko asida ebeko e de ma Amy Scientific Herbal Hospital say wo mo boaye na ye de apomude ho sam ebromada ro ma mo ye ntwen ho ye ba ye be di nkomo afa ene COVID-19 bibi aduru and afi Supreme Court nsem semi no ye be hwe na ye de ho nkomo ye twen ho aba.